Yes, it's true. Misophonia can be successfully treated. Actually, misophonia has been effectively treated in many clinics for many years now. Unfortunately, most of these clinics are located in Europe, and only a few can be found in North America. So, why is it that someone with misophonia can't easily find information about it from their family doctor or even a psychologist? What makes this situation possible? The answer is very simple. For many years, misophonia sufferers were treated based on their wrong assumption that their condition had strong connections to mental disorders, or was perceived as a psychiatric condition on its own. But today, we have a much better understanding of misophonia, and there are proven successful treatments that have been used for over 20 years. So, researchers agreed many years ago that this condition appears to involve the development of a conditioned response mechanism that is very complex. And what makes it so is that it involves many different systems working together: the auditory system, limbic system, autonomic nervous system, parasympathetic nervous system, and cortical short-term and long-term memory centers. But what does it mean and what is this all about? Let's explain. You see, our responses to so-called misophonia triggers are based on previous conditioning of certain parts of our brain. Again, to simplify it, our reactions to specific sounds or other triggers are based on what our brain has learned and the connections established between triggers in our listening environment and our state of mind, especially the impact of all extremely high levels of negative emotions caused by the brain reacting to what it perceives as a clear and present danger. You can learn all about it by watching our informative video. Hit the subscribe button now to watch it. It's quick and simple and allows you to gain valuable insights into misophonia treatments. And as for the misophonia treatment, we use a very complex approach that includes three main elements. Each element is necessary to significantly reduce misophonia-based emotional reactions to the triggers. Please remember that once misophonia is established, responses to specific sounds are controlled by principles of conditioned reflexes. Reactions are based on a very fast and high-level limbic system activation with the autonomic nervous system response. It's important to know how misophonia affects people emotionally in response to specific sounds and can trigger similar reactions to other stimuli, such as behavioral cues, visual cues, and even smells. However, sounds are the most common triggers for misophonia sufferers. TRT includes both counseling and sound therapy. Both therapies are based on the neurophysiological model of tinnitus. The main goal of retraining counseling is to reclassify misophonia triggers into neutral stimuli, and the sound-based therapy's main objective is to decrease the strength of misophonia-related neuronal activity. One unique aspect of TRT is that it targets the connections between the auditory and other systems in the brain rather than the underlying cause of misophonia. In effect, it is making the etiology of misophonia irrelevant to the effectiveness of the treatment. You see, TRT can successfully treat all types of misophonia as well as somatosounds. When you search, for example, Medline's website for tinnitus retraining therapy, you'll find over 100 publications. And according to most of these publications, TRT alone provides significant relief to more than 80% of patients. In addition, many randomized clinical trials demonstrating the efficacy of TRT have been published, and a lot of complex research is currently underway in several countries worldwide. But the main body of research on misophonia comes from Europe, mainly the UK. This is due, at least in part, to the fact that TRT-based treatments have been used successfully for many years now in leading medical university clinics in most European Union countries, where they are often provided free of charge. It's safe to say that the absence of this very factor contributes to the limited number of misophonia treatment clinics in North America. Only a few clinics offer this treatment, and as far as we know, the Metro Hearing and Tinnitus Treatment Clinic is the only one in Canada. It makes it even more difficult to understand why receiving the TRT in North America is so challenging, considering that both the medical and scientific community in the US and Canada is recommending this therapy. So to answer your question, yes, treating misophonia successfully is possible. Thanks for watching. And if you like this video, make sure to subscribe for more.